So thank you for your interest in this clinical trial that we're running, because we're interested in sudden hearing loss. Because sudden unexplained hearing loss in one ear is usually caused by damage to the inner ear. And the treatment that all doctors will use for that are steroids. However, what we don't know is what's the best way to give them. Is it by giving you tablets, an injection into your middle ear, or a combination of those two things together? And so this STARFISH trial will aim to determine how well your hearing recovers after one of these three treatments that we will randomly allocate to you. And then we'll be able to work out in a few years which of those treatments is the best. And so to help you with this, we'll have this video which will be useful, but also a really detailed patient information sheet. Because this is quite a large trial, we'll be running this in hopefully 75 hospitals across the UK. And we're going to need over 500 patients as well. So if our team think you are eligible for the trial, and you've seen this video, you read the patient information sheet, of course you're going to then be able to have the opportunity to ask any questions you like to the trial team, because before you agree to take part, it's really important that you understand what the trial involves and what it will mean for you.
So this trial has been designed with a group of patients who have sudden sensorineural hearing loss. And working with them, we've designed things to match NHS care as much as possible to make things easier for people participating. To ensure the trial is fair, we have to randomise patients. And this means randomly allocating a treatment to a patient where we have no influence over it and the patient has no choice either. This is important because it has to be a fair comparison of three different treatments. If you take part in the trial, you'll have an equal chance of receiving one of three treatments which is routinely used in the NHS. One treatment you might be given in the STARFISH trial is oral steroids. These are steroid tablets that you take in the morning every day for 7 days, and then the treatment ends. Another treatment we're offering in the STARFISH trial is intratympanic steroid injection. In this treatment, a small amount of liquid steroid is injected through the eardrum into the middle ear to directly act on the area of the ear that we think the loss has arisen from. We use a local anaesthetic for this procedure, and most patients don't experience any significant discomfort, and the procedure only takes a few minutes. If you have an intratympanic injection, we'll ask you to lie on your side in the clinic room for around half an hour after the injection, and this is just to keep the steroid liquid in the right place within the middle ear. At your first visit, once you've been allocated to one of the different treatments, we will administer that treatment or start your course of tablets. And we'll also ask you to complete a questionnaire, speak to the team, and do some hearing tests. If you've had an injection, either alone or in combination with oral steroids, we'll ask you to come back a week later to perform a hearing test and give you a further injection. And we'll ask you to come back a week after that for a further test and injection. All patients will then be seen at 6 weeks, when we will perform further hearing tests, ask you to complete questionnaires and speak to a member of the team. And then similarly at 12 weeks, we'll ask you to do the same three things, and that will be the end of your participation in the trial once those are complete. All treatments are commonly used and we know and understand them very well. There are a small number of side effects that can be associated with them, but overall these treatments have very limited side effects. Our patient information sheet can give you more information, and if you have any questions, a member of the research team will be very happy to answer them. At follow-up, there are three main ways that we monitor your progress. The first is doing a hearing test to detect your ability to hear tones and to hear speech. The second is a questionnaire to assess the impact of the hearing on your day-to-day activity. And the third is we'll ask you to speak to one of the research team to determine if you've had any problems and assess other aspects of your hearing recovery. As well as the in-hospital hearing tests, We are offering the opportunity to take hearing tests at home, both to assess your ability to hear tones and to hear speech. And these are very useful to the trial team because they tell us a little bit more about how your hearing is recovering, and they may be useful for you too because it allows you to track your progress after your treatment. These hearing tests are optional, and your participation in the trial and other care is in no way affected if you don't want to do the home hearing test. So we hope you found the patient information video really useful. We have further information in the patient information leaflet, or you can ask a member of the research team. We'd be delighted if you join the STARFISH trial, and together we can work to improve hearing outcomes for people with sudden sensory neural hearing loss.